sickle cell crisis, because this adult hemoglobin is the one that can be sickled. Is it clear? Is one that can be affected by the sickle cell pathology. Is it clear? So that is the first presentation, the handful syndrome. Generally the first presentation at 6 to 9 months when they present. And then the last vaso-occlusive crisis is a case of the acute chest syndrome. Acute chest syndrome, we need to know that this is a highly is a bad prognosis syndrome. Is it clear? Because it has high mortality and morbidity. Is it clear? So in this case, you have occlusion of the pulmonary vessels. Is it clear? You have occlusion of the pulmonary vessels. Generally, it presents with pains at the level of the chest, and it may have also signs of pulmonary embolism. Is it clear? So you are going to have wheezes, you are going to have things like wheezes, you can have things like pleural effusion, you have wheezes, signs of pleural effusion, but generally, if you have crackles, it's going to be it's a generalized crackles. Is it clear? It's not going to be localized. Now, if you have the differential diagnosis of this acute chest syndrome is going to be pulmonary embolism. It's going to be acute pneumonia, because it can have crackle, but it's going to be generalized and not localized in a particular location. Is it clear? Acute pneumonia. You can have also pleural effusion. Is it clear? Pleural effusion, which can be a differential diagnosis, because patient has occlusion of the pulmonary vessels. There's also occlusion of the pleural vessels, so there is hyperfiltration at the level of the pleura. Is it clear? So that is for the first syndrome, the first crisis. Now, so after visualizing acute chest syndrome, we are now going to visualize the next one, which is sequestration syndrome. Sequestration syndrome. Now, in the case of sequestration syndrome, we need to know that when you have sequestration syndrome, you need to know that, let's say that this is the spleen. Is it clear? The spleen is going to have the blood vessels that enter, and it has the blood vessels that goes out. Is it clear? Now, in the case of sequestration syndrome, what happens is that those highly viscous, those highly viscous cells, let's say that the viscous cells now occlude the distal site. Is it clear? When it occludes the distal side, you're going to have all the blood that is going to penetrate the spleen is not going to move out, so it's going to accumulate. So it makes the spleen to be very enlarged. Is it clear? So in case of patients with sequestration syndrome, it generally occurs between patients of 6 months to 6 years. Is it clear? 6 months to 5 years. Why? So it usually occurs in this age, because by that age you are going to have that 6 months is the age where sickle cell crisis start. Is it clear? And then 6 years is the age where you start having a functional asplenia. That's why I'm going to explain functional asplenia later on. Is it clear? When you're going to have chronic complications, but generally occurs between this age of 6 months to 5 to 6 years. Is it clear? So when it's going to cause like that, the spleen is going to enlarge. Is it clear? And when the spleen enlarge, when the child fails, the spleen can easily get ruptured. Since it's enlarged, it can easily get ruptured. And when it is ruptured, now you are going to have the patient having high hemorrhagic shock. Is it clear? So children that have hemorrhagic shock with a very large splenomegaly can be thought to have a sequestration syndrome in this case. After the sequestration syndrome, the next one is aplastic anemia. Is it clear? The presentation of aplastic anemia is going to be generally a pancytopenia. Is it clear? Pancytopenia. And this pancytopenia is a central pancytopenia, meaning that the bone marrow do not compensate for the low hemoglobin. Is it clear? So it's central. So in this case, you are going to have anemia, and the anemia is less than 2 grams per deciliter of the normal value they usually have. Their normal hemoglobin is usually 8 grams per deciliter. Is it clear? So when you have an anemia of already 2 grams per deciliter, it means that it is already, you can already think of an anemia in a severe anemia in the case of this patient. So in a case where you have a pancytopenia with an anemia that has reduced by 2 grams, is it clear? You should think of aplastic anemia. And you need to know that the etiology of aplastic anemia is a parvovirus B19. This is the etiology of the aplastic anemia. Is it clear? It can be contagious between patients that are sickle cell. Now, for the next one, after the aplastic anemia, you have hemolytic crisis. Is it clear? So in hemolytic crisis, you need to know that generally patients are all in sickle cell state are always having hemolysis. Is it clear? So that's why one of their complications in the chronic case is going to be chronic hemolysis. But the hemolytic crisis, for you to say hemolytic crisis, you should have a drop in hemoglobin by the 2 gram per deciliter from their normal hemoglobin. Is it clear? You should have a drop of hemoglobin by 2 gram per deciliter from their normal hemoglobin. So you should have a drop in hemoglobin by 2 gram from their normal hemoglobin. Is it clear? That's the first element. The second element, you should have other elements of hemolysis. And what are the other elements of hemolysis? Generally, hemolysis is going to be associated with the prehepatic jaundice. Is it clear? It's associated with prehepatic jaundice. When you are going to have hemolysis, a patient is also going to be jaundiced. Is it clear? Because of when there is the breakdown of hemoglobin. I've already told you that hemoglobin is made up of 2 portions. Is it clear? It is made up of the heme and the globin portion. The heme portion is what is going to produce the bilirubin. Is it clear? It's going to produce bilirubin, and that is what is going to make you to be jaundiced. Is it clear? In case of hemolytic anemia. Now, the other part of the hemolysis also, so those are the 2 major elements. You have a patient that is anemic and you have a patient that is jaundiced. Is it clear? And you have now other investigation that can help you to know that there is hemolysis or not. So this is how you can know if a patient has a acute hemolytic crisis. Is it clear? So that is how you are going to visualize the different acute complications of sickle cell anemia. Now we are going to continue with the chronic complication of sickle cell anemia. Thank you.